gonna do this,
So I'm going to just you tell how we are going to do, but I'm just going to identify the lines and then hand it over.
okay?
So you want to say how you're going to do it?
So I just wanted them first, go through level one, where you're trying to get them
Yeah.
alert and aroused. Then level two, now that they're aroused, what are you gonna do? How are you gonna start explaining that you're gonna get them up out of bed? Alright,
So here now, I'm going to just take your sheet off, okay? So I'm going to just identify the lines for y'all. So this is our oxygen. It's up on the wall here. It's supposed to be attached to a canister. We don't have that, but
and I was telling you about that high-tech piece of equipment.
yeah.
It's that, paper sleeve right there, which means that we can change those numbers.
Yeah, we can change those numbers. So you are going to look, as soon as you come in, before even waking the client up, you're going to look at the monitor. So what's that number? What is this?
That's heart rate.
Heart rate, what is this? Pulse oxygen, it's written there. What's this?
Respiration.
Respirations. And then this is blood pressure. And then we don't have the map on here, but we are not going to have you do all of that, okay? So this is her oxygen O2 cannula. So we are just going to put it around her neck. She had a trach before, so that's her trach collar. Okay, we are not this with that. This is a blood pressure cuff. So attached to the blood pressure monitor, her pulse ox. This is her heart monitor. Okay, so this is what is going. So the red and the blue lines are the heart monitor. I'm going to take your sheet off and just show them. So this is the sequential compression device. Usually there is one which is this is like a calf one, and sometimes in the orthopedic unit you can find one which is just the ankle based. So not calf based, but ankle based, okay? So we had one of each. So this is again attached to a pump there, and what does this do?
Circulation.
It squeezes the calf and this prevents DVT. So it simulates walking. Yeah, okay? These are the grippy socks, so always make sure that they have. We have this one here, we are not really going to use that. Then on this side, she has a catheter. Okay, making sure that it doesn't leak. She has a chest tube. So this one, clients, when they get up, they can carry it like this. So it looks exactly like that, but it's a little light. She did have a wound there, so there is a wound vac which is draining in there on her leg. She was impulsive, so we have put restraints on her on this one, okay? So this one, we'll take it off.
So can you just go in the room and take the restraints off?
No.
You probably wanna go ask nurse, talk to nurse, and why they on,
Yeah.
how they've been doing that day, just to get
And-
up to date.
Yep, and then when you take the restraints off, you have to be careful. When you leave, you have to put the restraints back on, and there's usually in acute care, there's a check sheet which says, oh, this time you took off, this time you put it back on. Okay, so this one is a different one. In acute care, we have different, this is much easier, but you can do this, okay? This is our IV line. So it's going under here. And then this is the chuck pad, and we're going to show you also. Does anyone know how, when a client cannot do anything, how do you move the client up with the chuck pad? You want to come on this side, Dr.
So it's typically just a coordinated lift, gonna raise the bed up.
Yep, raise the bed up. So this is a call bed. So we have to make sure that it's there.
Alright,
So I know she's, please put down some.
that's good. And so one person has to be the one that's giving the commands.
Yeah.
So we're gonna scoot her up on the count of three. Let's go over first. So on my count, 1, 2, 3. Okay. And then how can I make this easier?
Tilt it.
Yeah.
Good. So what is this?
Lift leg on the foot.
What's
And
that
we
position? Trendelenburg.
Oh, so sometimes that bed has the whole thing goes up. Okay, now lift your head up for us.
1, 2, 3.
Okay, so you have to have now, see, I am shorter and this, so I have to have a bigger stance so that I don't lose my Okay. We do want to show you how to place a bedpan.
Will you have to do this at some point? Possibly.
Uh-huh. I have had to do it so many times, so usually do you mind if I do this, or I don't mind, okay. So usually we have a, I know, when I act it out, you can, and then we, bend this. And then if she can lift her hips up, it's easier, okay, just placing it like that.
But
This is a small one, really,
So
no?
it goes where?
So.
it goes up under her bottom.
Okay,
Under
so
her
like,
bottom.
It's not gonna stay there, right?
Yes,
She's
Yeah.
gonna use it and then you're gonna move
you put
it.
that,
Exactly.
that side,
Yeah, so this side is up because then it'll catch,
So-
this
so-
will catch the urine.
this is a trick to doing this.
Or I was going to show this, yeah.
So, yeah, you can roll her.
Roll her.
Take this a little.
So if you're by yourself, then usually we roll her, that's also kind of.
Yeah. You're gonna have to take it loose. It's both sides, yeah. So what you wanna do is roll her
Roll
this
her,
way,
and then-
hold her here,
Here.
hold on. No,
Oh.
bring this, you're using that to roll.
I know.
And then putting that here.
And then roll her. on
And
the-
as high up as possible.
Yeah, high, and then roll on the other side. We need to get that other one, the flat of bedpan, like.
Now,
this
do
is
patients
hard.
like these? Absolutely not, they would curse
And
you out.
if you leave them there, I have had seen, they have around their bottom, and people have left them too long on the bedpan.
How do you like clean after without it getting on the bed?
Roll
Roll
again,
them.
yeah, roll again.
So you do this
like a
chuck
little
pad,
bit
that's
right
why
there
this,
and then move it.
Yeah, they
this
usually
chuck
have
pad
those
has to be on top,
throwaway
or,
ones.
yeah,
Hmm.
or,
Like, like the dog, the pee pads, they usually have them under the bed.
They can, but
Yeah.
people, just think of yourself, would you want a stool under yourself? No.
so usually I'll use this kind of pads under there, and then this can be thrown away, okay?
Yeah.
Like-
Under the bedpan, not
Under
under
the
the
bed.
person saying,
Right.
Yeah.
just
No.
go and I'll clean it up. That's
Cause I've been.
that's not dignity,
Yeah, that's not, people have done that.
yes.
Okay, do you mind if we, okay, so this is an adult diaper. We left her on the bedpan.
So again, you're gonna roll her, hold her here, and then you wanna make sure that you always put enough.
Yeah, and make sure. that
Under.
this,
Alright,
and then
and then you're gonna roll her
back.
back, and then, now can you roll the other way?
So this is like how you put the belt, the
Okay.
brace on,
And
back
from back.
brace on.
As you
and then
see,
yeah,
I'm
then-
kinda familiar with this process. because,
Yeah,
Yes,
yeah, and then you bring it up and snap this, okay? There are different sizes of diapers, accordingly you have to. We do not like to put diapers on clients, that is not of the sinners, you have to take them more often to the bathroom, or if they have a catheter, but that's not, because people have been left in diapers, so that's not a good place.
I will say, try to get the patient to do as much as possible.
Oh, yeah.
Every time they do the rolling, they're able
That's
to
your therapy.
roll themselves, that's therapy.
That's
And
therapy.
you're getting them prepared to start getting over to a
So,
bedside
yeah,
commode
that's a
versus
very good
doing
point,
this.
and we need to remember in the afternoon. So what happens is, even you are working now with them, and then the client says, oh, my diaper is soiled or whatever, and they need to change, and then you don't just walk away, call the CNA and call the CNA and say, I'll help you, and then you do not have to leave them and go, because then you can have them roll over, instead of just the CNA just pulling them up and shoving that bedpan under there. You say that I'll
So,
help
Layla,
with rolling.
You remember those things I had you do yesterday? If you can first point your finger up towards the ceiling there. Yeah, can you move it up? All right, can you bend that knee? I'm gonna have you look towards me. Now, can you roll towards me and grab for this rail? So some of those same things that we did in movement. As soon as you can start getting the patient to do this, you're gonna have to do less when it comes to changing and,
But before we do that, we make sure that the lines aren't in the way.
yes, you're gonna check the lines for sure.
Yeah, what,
Placing a bedpan and thing, is that something that would be on the comp?
No.
Changing diapers?
no
We
bedpan.
just don't want students to go on field work and say, I've
We-
never seen that.
We
before.
have
I have
student-
no clue of what that process.
Now, one student said this,
Yeah.
they asked me to change the diaper, and I had no clue, I'd never done it with adult diaper.
But I will say, when you go into a room and you're working with a patient, typically once you start moving them, their systems are gonna start
Yeah,
working.
yeah.
So this may be a part of your treatment. You can't just be working with them and say, oh, I'm gonna call a nursing.
Yeah, and that's not my job.
Yes, so, if you're in acute, I would go ahead and get ready for that.
Yep.
Because most CIs think that this is just as much their realm than, as much as nursing's around. So we're gonna let y'all start looking at what y'all would do at level 1, what you would do at level 2, getting a person up between 2 and 3, and then some activities that you would do for those higher levels, functional, all right?